Hi, this is Dr. Greg Oliver, and welcome back to Fat Doctor TV. Last episode we talked about hormones and their effect on our obesity and weight management, and we're going to continue today with the second in that series, and we're going to talk about the most common hormone abnormality in females of reproductive age that causes weight problems. And for many young women, all the way from teenage years up to menopause, which would be around 50, many will experience problems related to this syndrome. It's called polycystic ovary syndrome. And I'm going to explain a little bit about that syndrome, how it affects weight, how it affects a lot of the health of the woman. And if you're a woman who says, I just can't lose weight, I keep gaining weight, I have a problem with carbohydrates, I feel like I'm hungry all the time, and have a lot of other symptoms we'll cover, then this may concern you and you may want to reach out and get some medical help for this. So what are some of the key symptoms that occur with polycystic ovary syndrome? Well, the name of this polycystic ovary syndrome comes from the fact that the ovaries in most women with this syndrome do appear to have a large number of cysts, or fluid-filled sacs, or cysts we call them, around the outside edge of the ovaries. It's not the case in 100%, but many of the women have those, and that can sometimes be detected on ultrasound. The other thing that we know is that women with this will have infrequent or prolonged periods, excessive weight gain and obesity, acne, excess hair growth, infertility problems. The cause is unknown, yet we believe there are some specific genetic factors involved. We do know also that having polycystic ovary syndrome will lead to an increased risk of diabetes, heart disease, and can lead to stroke. The main symptoms, as I mentioned earlier, and I'll repeat again, are irregular period, excess androgens or excess male hormone. We believe that in polycystic ovary syndrome, the pituitary gland in the brain that tells the ovary to function properly may be sending a certain signal that makes the ovary produce too much male hormone. And of course, with the male hormone, we'll see acne and excessive hair growth, especially facial hair, axillary hair under the arms, and hair on the rest of the body. That sometimes does depend on the ethnicity of the female. We know that Northern European ethnicity tend to have less hair growth than Mediterranean women. So hair growth is sometimes related to the ethnicity of the individual. Infertility is a problem, obesity is a problem, pre-diabetes, diabetes, those are problems, and a skin condition called acanthosis nigricans. That is a dark-colored velvety rash that's a little bit rough, usually around the neck, sometimes in the axilla, sometimes on the fold areas of the body. And that also is very classic in people with prediabetes and diabetes. So these rashes also occur in individuals with polycystic ovary syndrome in many cases. Again, we think that it's possible that the pituitary gland may be a problem in this. We also know there are some genetic factors, and if your mother or a sister have polycystic ovary syndrome, you may also be at risk for polycystic ovary syndrome. We also know that increased insulin levels occur. Of course, when insulin levels go up, hunger goes up, and in many cases the weight goes up. So that is also a key feature in this syndrome. We also know that there's a low-grade level of inflammation. Sometimes can be measured by the C-reactive protein in the blood. So that inflammation level, which occurs in the blood vessels, can lead to premature cardiovascular or heart disease. Complications abound with PCOS or polycystic ovary syndrome, including diabetes mellitus, high cholesterol, increased inflammation of the blood vessels, obesity, metabolic syndrome, which has to do with multiple factors that are included in weight and obesity, the size of the body, the size of the neck, the size of the waist, blood pressure, things like that. Sleep apnea can occur, abnormal bleeding cycles and irregular cycles, and an increased risk of uterine cancer. So this is a serious disorder and needs to be taken seriously. So if you have any of these symptoms, certainly you want to see your physician or healthcare provider. The diagnosis is made through a careful history of a lot of these symptoms, also physical examination, including a pelvic exam, and in many cases an ultrasound of the ovaries looking for the polycysts, the excess cysts, and blood tests looking for higher levels of androgen. In many cases, insulin levels may be important also. The treatment of this disorder is certainly to lose weight. We know that by losing weight, we can decrease insulin levels. Increasing exercise can decrease insulin levels. Decreasing carbohydrate intake can decrease insulin levels, and taking a medication called metformin, or the brand name of the drug is glucophage. And knowing that that particular drug will decrease insulin levels can sometimes restart normal periods, cause weight loss, and affect the whole process of polycystic ovary syndrome. In women who are not looking to get pregnant, oral contraceptive therapy or birth control pills at low dose can be quite effective in managing the periods. In some cases, surgical intervention is needed. We won't go into the specific surgical techniques that are used both to help polycystic ovary syndrome and to help women who are looking to get pregnant who have polycystic ovary syndrome. I think the key feature here is that if you have a weight problem, you have excess hair growth in areas of the body that you shouldn't have hair growth, if you find that you're hungry all the time and feel like eating excess carbohydrates, you certainly could have polycystic ovary syndrome, and it's critical and important to get to your physicians, because physician-managed weight loss, physician-managed medication and therapy can help to control this disorder that you have, this hormone imbalance that you do have. So if you have other questions about polycystic ovary syndrome or PCOS, please feel free to contact us here at Fat Doctor TV, where we can maybe give you some additional answers to your questions or direct you into the right path to help get the diagnosis or treatment that you need. So again, we'll continue our series on hormones in future episodes. We look forward to talking to you soon. So have a great day. This is Dr. Greg Oliver, Fat Doctor TV, saying looking forward to seeing you next time. Bye now.